Hi guys, so of course this is fantastic news. The vaccine is on its way. There were images on Wednesday night of it being loaded onto aircraft bound for the UK. The UK is receiving the vaccine or rolling out the vaccine a few weeks before the European Union because the European Union want to carry out more checks and in their eyes to be more sure that it's ready to go. But it's a number of weeks of differences, so it won't really have that much of an impact. Now, Boris Johnson is going to pass over to his colleague in the NHS, who's going to explain who is going to receive the vaccine first. So let's hear what they had to say.
As we do all this, we're no longer resting on the mere hope that we can return to normal next year, in the spring, but rather the sure and certain knowledge that we will succeed and together reclaim our lives and all the things about our lives that we love. So I want to thank the scientists and all those around the world who've taken part in the trials and got us to this stage. And I want to hand over now to Simon Stevens of the NHS.
Thank you and good afternoon. Obviously, as the Prime Minister says, today is a news bringing great optimism. We have a vaccine that has been independently shown to be both safe and effective, but I suspect that what people want are practical answers to three questions. Who will be first in line? When will the vaccines be available? And how will we get it to you from the NHS? So taking those three questions in turn, first of all, in terms of who will be first in line, as the Prime Minister says, the independent medical experts, the Joint Committee on Vaccination and Immunisation, have clearly recommended that the NHS should make sure that the first people to be offered the vaccine are those at highest risk, together with the people who look after them. In practice, what that means is starting with the over 80s, who are at much higher risk of severe outcomes from coronavirus, as well as people in care homes, together with some of the frontline health and social care staff who are looking after them. And then as more vaccine becomes available, we will be, in the new year, extending that to many more people across the country in line with the JCVI recommendations.
Okay, so the idea that the first people to receive it are in care homes. Now, this is part of an article from The Guardian, and they raise an issue. I think this is an important issue to remember when it comes to delivering it to care homes. This is not going to be easy. So it says here, BioNTech, which developed the approved vaccine with Pfizer, had said it could be used in care homes. If you store the vaccine in a fridge, you can store it up to 5 days, said Sean Marrett, the chief commercial officer. If you want to take some of those virals out of the fridge containing the vaccine and ship them to a local care home, then you have to do it in 6 hours at 2 to 8 degrees. So that's not a huge problem, but that appears to present a too tight window for some care homes, especially if they're not close to the distribution hub. It doesn't seem as if the Pfizer vaccine could be easily rolled out to care homes, said one senior care industry source. It offers a very short window and its administration will take longer in a care home. This isn't a case of people lining up with their sleeves rolled up. So what they're talking about here is that, if you're delivering this to members of the public, you can get the members of the public to turn up at a center, a site where they, wait, they roll up their arms, and then they go through and they get the vaccine. This is not the case in care homes. You need the staff. You need the staff to deliver it to the patients. Patients can't wait. You can't have a queue of patients because they have maybe health issues. They have to stay in bed. They're not able to move around. You have to go to them. They can't come to you. So I think this is one problem. And then if, of course, the care homes are far away from the distribution site, this is going to create logistical problems. I think it's important that there is a vaccine. I think it's very important that we're moving out of this pandemic, but there are many logistical problems to be overcome first. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.